Assalamu alaikum wa rahmatullahi wa barakatuh. Mariam is here. If it's the first time that you are coming to this YouTube channel, welcome. It's my pleasure to have you. My name is Dr. Mariam. I'm medical personnel by profession and also I'm a social activist. I hope that you will get benefit from this YouTube channel in 2025. I hope that we grow well. A happy new year. Inshallah, we're happy this year to be the best year for ourselves, for our dunya, and for our akhirah both. Um, I have been in medical field for quite some time, and although that I school in Somalia, I moved to Kenya for a years back, and I have been here for so quite some time. As you have seen in the thumbnail, the topic that I want to talk about is related with medical professional personnel, the people that outside in their countries. Like if you're outside in Somalia, that you came to a non-Islamic country and you want to practice your medical profession, and you want to balance your profession and your akhirah, I have a beautiful tips for you that you can go through and then try to apply, and I hope it will work for you. Balancing a medical profession and your dunya is really a challenging thing for a lot of people. And medical profession needs commitment, needs resilience, needs a lot of things, and also your akhirah also needs that kind of effort. Medical profession needs resilience, strength, hardworking, spend a lot of time in your profession, and your akhirah needs as well. And the way that the people do in the profession is so busy and it needs a lot of time to spend. So there is something that I am practicing and I am trying to balance since I came to Kenya, which is really, the first moment is really hard to me to balance in my akhira and in my medical profession, because, and especially the prayers become very hard to me to comment the timing, because there is a lot of things that you need to make your salah, or to have a good commitment with your salah. Adhan is the most important thing that you need in your prayers. If you are not hearing adhan, you are not seeing people praying, you are not seeing people going to mosque, it's really hard to you to continue having your prayers, to have a good commitment for your prayers. In general, I have beautiful tips for you here that you can apply, and I hope it will work for you. At the end of the day, everyone wants to go to Jannah. So it doesn't matter to be a medical profession or to be a stay house mom or to be an engineer. At the end of the day, you want to be a good Muslim, you want to go to Jannah and Allah subhanahu wa ta'ala. And we're asking Allah subhanahu wa ta'ala to bless us. First point that I have for you as a medical professional wants to have a balance between his akhirah and his profession. First one is prioritize your prayer. Prioritize your prayer. And the way that you can prioritize your prayer, the way that I have done, and it really worked for me, set alarms for your prayers, like Fajr, Dhuhr, Asr, Maghrib, Isha, set alarms. And set alarm 30 minutes ago. So if you are in surgery or if you are in meeting, to know that in the coming 30 minutes, that specific prayer will come. So you have to have your calendar in your phone. Number two, if there is a Muslim community that you have in your hospital or in your university, have a good, close relationship with them to make your prayer goes well. Because if you have that community, it reminds you that people are going to mosque, then you can go with them. It's really important. The third tip is you can prioritize your prayer. Don't squeeze the prayers. Always try to finalize and to finish most of the work for the day before the Dhuhr comes, because Fajr and the Dhuhr in Africa, we have a good time that you can make most of the hard work for the morning time. So when it comes one that you are ready for the coming prayers to pray. So don't squeeze the time. Have a good timetable. And the fourth tip that I can give you to prioritize your prayer is have your prayer mat in your bag. So you might not get mosque in your hospital, or maybe in your medical school, maybe they don't have a prayer room. So have your prayer mat in your bag. So it will be very easy for you to just put a clean area, and then you know where's your qibla, and then you just pray. I think it makes sense. Number two, seek knowledge with the right intention. You need to continue learning Islam. Like you need to continue learning tafsir, you need to continue reading Islamic books, you need to continue learning Tawheed, you need to continue learning fiqh. You need a continuous learning. To surround yourself in that knowledge, it will prevent a lot of issues in your akhirah. It can affect your dunya and also it affects your akhirah. So in the medical profession, there is a lot of dunya stuff that's surrounding you. So by continuing that knowledge, it will help you to protect yourself from indulging those kinds of haram stuffs. So you need to continue learning. Number three, uphold Islamic ethics. We have a beautiful Islamic ethics. We need to uphold Islamic ethics like trust, like telling the truth, like confidentiality, all those things. Because the way that you can get ajr from your practice in a medical profession is to uphold Islamic ethics. So it's very important. Number four is foster a supportive network. You need a supportive network that can make you close your akhirah, close to Allah subhanahu wa ta'ala in your medical profession. So always look at people that very good in prayer. Always look at people that very good in reading Quran. It will help you to grow. It will help you to protect your akhirah. It's very important point. Number five, balance your time. Balance your time. In the morning, we have a good time. You need to balance your time. You need to have a beautiful timetable that gives you a time for your akhirah and a time for your medical profession. Like in the early morning, you can practice reading 2 juz of Quran or 1 juz while you are going to your work, your workplace. You can listen. You can listen a podcast or you can listen muhadara. So that makes you have a balanced time in your day. It's very important. You need to balance your time. You cannot behave with the way that the other people do, because you are like you are a special person. So you are Muslim. So you want to practice just to be Muslim by name. We need to be Muslim by practice. So to have a balance, to balance your time is very important. Number six, we have embrace modest in dressing and behavior is very important. In medical school, we have a lot of restrictions when it comes to dressing. There is a way that you're supposed to dress for infection prevention. So you can't go to the work, you can't start working while you have your abaya, while you have your long dress. There is a specific medical profession. So for male, they have their dress. For women, they have their dress. But that dress, it doesn't make you to look like that you are a Muslim person. So you need to make sure that you protect your hands. You use a long sleeve t-shirts. You need to cover your head. You need to use a flavy and a good fitting trousers and a good fitting shorts. So that makes you look like the clothes very important to not stick in your skin. You need a widened trousers, or if you can wear a long dress that reaches to your ankle, is very good. So you make sure that you cover your head, cover your neck, use a long sleeve t-shirt, and also use a widened fluffy cloth that's not stick your skin. And also make sure to use a lap, because the lap is very important. It covers the most beautiful part of your body, especially if you are a woman. So it's very important. Number seven, and I want to conclude this number, is stay resilient and trust in Allah subhanahu wa ta'ala's plans. In medicine, you will learn a lot of things. You will learn how to be patient. You will learn how to be a resilient person. So you need also to put your trust in Allah subhanahu wa ta'ala, and your medical profession, it will be smooth. I hope that you get benefit this video. At the end of the day, we are Muslims. We need to be close to Allah subhanahu wa ta'ala, and also we need to practice in our profession. One more time, I'm very proud to have you here today. I'm very proud to have you in this video. Till next video, Assalamu alaikum wa rahmatullahi wa barakatuh.